All right, thank you everyone. So we're going to start with our didactic today on motivational interviewing from one of our known hub members, Dr. Evan Holloway. And as Evan is going through this content, be thinking about, does anyone have a patient or a student or a family for which this tool seems like it could be helpful, that they'd like some group brainstorming with in our second half of the hour in the case-based learning. So with that, I'll turn it over to Dr. Holloway.
Thanks, Dr. Brewitt and Dr. Hack, and for everyone. Oh, I forgot to turn my camera back on because the mindfulness was so effective. Thanks everybody for joining today. Nice to see you. I'm excited to be presenting on one of my favorite kind of clinical skills, motivational interviewing. I don't have a slide on this necessarily, but I've been just reflecting on how, when I was first trained on motivational interviewing, I've been using it for the last 15 years. I first got trained working with caregivers of kids with chronic runaway behavior. And so that thinking about working with caregivers was something that is one way I'm kind of approaching this, but this can be used with caregivers, with youth, with your neighbor. So keep all of that in mind. Don't have any disclosures in terms of commercial interest to disclose. Would like to say that we are supported by HRSA and the California Department of Healthcare Services, Prop 56. So our learning objectives today are, I hope you'll be able to understand the spirit of motivational interviewing, identify change versus sustained talk, identify two different types of reflections, and be able to use motivational interviewing in your practice. Specifically, to be able to change closed-ended questions to open-ended questions, identify stages of change with students, youth clients, and caregivers, and use at least one OARS skill. That's the acronym. All right, I'm gonna jump in and also just to give a little variety in my, so you don't just hear my voice. I thought this was a really nice summary of kind of the spirit of motivational interviewing from one of the developers. So I'll go ahead and jump in.
Fundamentally, motivational interviewing involves a change in role, a change in how you think about what you're doing. You're not the expert there to fix the person. You don't have to make the person change. The truth is, in fact, that you can't make a person change. You don't have to be the one to come up with all the good ideas. A person with really good ideas is sitting across from you and may have better ideas than you do. It's not like a competitive sport. It's not like wrestling where you try to defeat and pin and outsmart and outwit the person. It's more like dancing together, moving together, adjusting your movements to the other person. Overall, motivational interviewing is not a directive approach. Neither is it just a following approach. Following is listening to the person and kind of going wherever they go. Motivational interviewing is in the middle, between those two, and we describe it as guiding. If you go to another country and you hire a guide, you don't expect the guide just to follow you around. That's not what you're looking for. Neither do you expect the guide to order you when you will arrive, when you will leave, what you want to see, what you will enjoy, what you're going to do. That's not a good guide either. Good guiding involves good listening, as well as using your own expertise. A good guide will find out where you want to go, what you're interested in, what you're hoping for on this journey, and then help you get there using his or her own expertise, enjoyably, safely, efficiently, perhaps. That's the guide's job. Not solely directing, not solely following. There's some of each in it, but it's a blend of those things. This may or may not be the way you've been thinking about your own work, but we invite you to try it out.
Awesome. I also think William has a very calming voice, so that was a nice addition to our continuing mindful practice. Okay, so to summarize, in other words, what is motivational interviewing? You're if you're kind of having fidelity to this practice, you are realizing that you are not the expert, right? And the folks that you're working with are. They have expertise in their life. And so if you're coming and you kind of have this sense of, here's what you need to do, it's important to identify and check that. It also can help take the pressure off of you, right? And realizing that the client has the responsibility for changing things in their life. Motivational interviewing strategies are more persuasive than coercive, more supportive than argumentative. And clinicians should be trying to seek to create a positive atmosphere conducive to change if clients would like to do that. And in keeping all of this in mind, it's important to remember that you want to identify the client's values, and that really should be driving the work. Okay, so folks who are really in the MI world will talk about the spirit of MI. And so one of the key components of that is partnership. So you are working collaboratively together. Another is acceptance, identifying that the client has autonomy, they should have autonomy, and the ability to make their own choices in accordance with themselves. Super important is compassion, making sure that you're empathic and supportive in response to whatever it is that the client is experiencing. And to evoke, right, evocation of what it is that the client would like to change. And so really thinking about how can we pull that out of or identify in what the client is describing some ideas about things that they may want to change or not change. Some other principles of motivational interviewing are to express empathy. And so we do that by using reflective listening to convey that we understand what the patient's point of view is and what's really motivating their behavior. Reflective listening is one of the key kind of strategies, right? And it can be as simple as responding back to the client with like exactly what they said, or having kind of more sophisticated reflection as well. Develop discrepancy. So identifying discrepancy between what the participants' values are and their current behaviors. And that's one way that we can help evoke and increase motivation to change. Rolling with resistance. So identifying when there's resistance within a client and responding with empathy and understanding rather than confronting that change. Supporting self-efficacy by building the patient's confidence that change is possible, and amplifying ambivalence. Whenever we're thinking about making changes or making a decision, oftentimes there's ambivalence, and it can be hard to think about both sides. And so acknowledging ambivalence as a normal part of change, and then helping the patient explore that. So these are really the key principles of MI. So I'd like you all to think about something that you have changed about your life in the past, something that you would like to change in the future, and see if any of these ring true. Change, even if it's something you're excited about, can be difficult and not always comfortable. It's often easier to stay the same. And another talk, I've talked about this concept of homeostasis and how we kind of come back to baseline, or the things that are more comfortable, things that we're used to, even if they're not adaptive or not really working out for us. And so recognizing that the sort of baseline or the normal is to not make any changes. When we do make some changes, we can tend to go back to our old ways. And so identifying that as normal as well, and expressing empathy whenever that might happen. Whenever people are making change, it requires some creativity, a new way of thinking about things, having an open mind about that change. And change has both emotional and cognitive components. So the way we think about making those changes and the way we feel about making those changes are both really key. I want to draw our attention to two of these that are really relevant to motivational interviewing, in that it's easier to stay the same, and we tend to go back to our old ways whenever we're thinking about a change. And whenever we see this happening, it means that the client or ourselves, we're kind of stuck in this ambivalent state. And that's okay, but important to recognize. So there are a number of different skills we'll get to later, but really key to figuring out how we're going to approach our clients is making sure that we're matching the skills we're using to the client's stage of change. And this may be familiar, but really key to motivational interviewing. Draw your attention to the top. So whenever we are not kind of aware, or we're aware that there might be a problem or something we want to change, the pre-contemplative phase is where someone would start in this cycle. So we're like, nope, I don't want to improve my sleep quality, right? Or go to bed early, for example. So there might be no desire to change. And the next kind of stage in change would be to move towards the contemplative phase, where we are aware, all right, my sleeping 4 hours a night is not great, but there's just too much going on. I can't really think about making this change. And so whenever you identify that a client or a caregiver are in the pre-contemplative or contemplative phase, then there's a certain set of skills that we want to focus on. So I'm going to provide this example to kind of think about these stages of change and the different skills and strategies that we might use. So this is Tim's caregiver, and Tim's caregiver has come and is asking you for help because Tim is refusing to go to school. And we know, either because they're reporting it to you or because you've been working with this family, that you've referred the caregiver to take Tim to see a psychotherapist to help address this problem, right? Or maybe some other anxiety in the past or other behavior. And Tim's caregiver said, I know that there's a problem, but I don't believe in therapy, right? And so there's been a solution that has been offered, and the caregiver is like, nope, I'm not really ready for that, or I don't like that option, and that's okay. And so in the past, we might have identified that Tim's caregiver was in the pre-contemplative phase, right? So not thinking about making a change, not seeing a problem. And so if Tim's caregiver was still in this stage, some of our goals would be to understand the current behaviors and patterns that are happening at home, the nature of caregivers' resistance to considering change, assessing their sense of self-efficacy, right? How much control do they feel like they have over the situation, and then making changes. And so it would be important in working with Tim's caregiver at this stage to express empathy and acceptance, and then ask if the caregiver would like some information or a solution, right? And then to identify their goals for health and well-being, and ostensibly to help Tim get back to school, because Tim not going to school is causing a lot of problems, and caregiver has to go to work. And so something that the caregiver might say in this stage of changes, or is that they're going to kind of think about it. All right. It seems like in the example that Tim's caregiver is more in the contemplative stage. So considering that there could be something that could change, but haven't taken any steps and are not kind of ready to take the steps that might have been offered. And so at this stage of change, your goal in working with Tim's caregiver is to help identify obstacles to making a change or trying something different, working on enhancing coping skills and self-efficacy for the caregiver, taking even small steps towards change and commitment. So maybe we don't believe in, we're not sure about taking Tim to see a psychotherapist. What are some other things that we could support Tim's caregiver in thinking about, right? And in supporting them in identifying maybe a different solution or something else that could help in the meantime. At this stage, you also can consider sort of the introducing a cost-benefit analysis of the behavior, right? And so kind of staying the same or making a change. We're going to go into more detail on that on the next slide. You also should evaluate past attempts at changing behavior. Is this something that's happened in the past? What have you tried? What's worked? What hasn't worked? And even if it's not this exact same behavior or same situation, what in the past, what other ways have you kind of responded or changed the way that you've done things in your family to help support your child or yourself? or other types of help-seeking behaviors in the past. You want to help try to decrease ambivalence, right? And at this stage, so that we can move them to the next stage of change. And so, and this can help strengthen their intention to change. I'm going to give an example of this cost-benefit analysis, or what we might also call decisional balance. And so you could this is something that you could do again with yourself, with a client. And so if I were meeting with Tim's caregiver, I would try to ask some of these questions. So what are the positive things, right? What are the things that are working well and sort of staying the same, right? And in this way, right, we're asking an open-ended question and we're trying to elicit with them. They might identify, right? Well, you know, I just don't have enough time right now. So like not making a change in this means that my calendar, that my schedule doesn't get crazier than it already is, right? You also could ask about what are the negative consequences of staying the same, both now and in the future, right? You might hear something like, well, Tim isn't going to be more likely to go to school. You could also ask about some of the negative aspects of change. So what will I lose, or what's going to be harder about the situation if I do take Tim to go see a therapist, or I try something else, right, that the caregiver has identified. And then finally, what are some advantages of change? What could a different future look like, right? What kind of positives could that introduce into your and your child's life? And so asking some of these questions and kind of weighing the positives and negatives of not doing something or trying something different, and eliciting that of like, what would you like to try with a caregiver, even if it's just a small step in just considering making a change, that's progress. Okay. So I'd like to introduce you to the DARN CAT acronym for skills. And this is really helpful to identify what we would call sort of this change talk versus sustained talk. And so as you're asking some of the questions on the last slide, or other open-ended questions, it's important to pay attention to the type of language that the person is using. Desire, right? So I want this, or I'd prefer this. I wish this would happen, or this weren't happening, right? Ability, you know, I can do this, I could do that, I am able, I'm not able, right? Or that's just not possible right now. So you can hear in those different framing, right? People might be more likely to sort of, there might be, sustained talk might be more prevalent than change talk, but it's really important to be identifying some of that change talk, some of those little openings to think about something being different. Reason, so why do it? What would be good about making a change to help address this current problem? Need, is this important? Is this something that I have to do? Is this something that matters relative to the other things that I have going on? Or this isn't, right? This is something that's going on, but there are other bigger issues in my life right now. Commitment, so I will do this, I will seek a new solution, and that can help signal more of the change talk. Activating, so any discussion around preparation, thinking about making changes, right, and goal setting, and then actually taking steps, which is great. Any planning or action. And I realize as I said that there's like a value judgment. I'm like, that's great, but really any identification of change talk, we want to identify it, and that gives you something to work with. Okay, so let's say we identify some change talk, and that is a key indicator that someone might be in this preparation stage of change, which is awesome. And so this means that someone's getting closer to, or has made a decision to change, and would like to do something about that, right? To take action towards those goals. We also might identify that someone's like, they have made it through this preparation phase, and they're actually actively working to make those changes, even if they just try once, right? And so let's talk a little bit more about these two stages of change and things that you might ask, right, or consider in working with Tim's caregiver now. So, you know, Tim's caregiver, what would you like to change, right? What are the things that you would like to consider doing differently here? If you did decide to make this change, how would you go about it? identifying some reasons to make that change, the advantages and disadvantages of kind of staying the same versus making this change. And then it can be really helpful to identify, like, on a scale, how important is this change to you? And how confident are you in making that change? And this is, it's great to kind of to assess this, because you can track this over time and help figure out how much of a priority this might be versus other things that they might be experiencing in their life. So thinking about how to support someone when they're in this action phase, it's important to help get them ready to implement that plan, to reinforce any steps towards making that change or signals towards commitment, identifying external support and motivation. Again, making change can be really scary and hard, and so helping to make sure that someone has the support and other sort of motivating factors that can help make this long lasting. Help increase their self-efficacy, and offer information about a range of options for action and change. And that can mean both different types of changes that someone might want to make in their life, and then also if someone's feeling like really overwhelmed, like this just feels like so much, right? Using kind of helping the client with permission to identify something that's really achievable, that has a shorter time frame, and is more likely to kind of help them feel some success, right? And then keep monitoring that change over time. And so our goal here really is to just support the action and the change that the client is already engaging in. If you get to this maintenance phase, that's awesome. It's really positive. And so let's say someone has made a change and they're kind of sticking with it. Here we want to identify factors or things that can kind of undo some of that change, new stressors that might make it harder for them to kind of stay committed to this behavior, right? And the reality is that someone might move towards, through these stages of change, pre-contemplation to contemplation, and they might come back to pre-contemplation, right? Like, actually, I don't know if that really is a problem, right? And so it is normal for people to kind of cycle through these stages. And so identifying if and when that's happening, and with the client's permission, helping to support them in thinking about things that can happen in their life that can sort of take them back away from their goals, or help them move forward. And so the goal in this phase really is maintaining those new behaviors and continuing positive change. As I said, cycling through these stages can be really normal. And so encouraging the participant to re-enter that cycle, reinforce any willingness to do so, and continuing to identify that change talk versus sustained talk is really important. Normalizing a learning opportunity, right? And okay, we tried this didn't quite work for you. What else can we try, right? And helping them develop and use coping strategies as they keep working on making changes in their life, and maintaining supportive contact over time. So I use these skills like all the time. And clinically, when I'm not sure quite what to do, I kind of come back to these. These are the OARS skills, and I'm going to briefly go through these because I've got a nice video to get into more detail. Open-ended questions are really important to use because they help a person who's being asked to really reflect on why they're feeling a certain way, right? So if ask like, would you like to eat lunch today? Yes or no? That's a close-ended question versus why would you like to go to this restaurant today for lunch, right? You're going to get a more detailed answer, and it would cause someone to think about, well, I really wanted the Reuben at, I don't know, I don't think God's Roadhouse has one, but at this restaurant. And it really gets people to think about, well, why am I doing this? Why do I want to go do this today? Affirming responses. So to reinforce what people are saying and that they're engaging, right? And thinking about identifying these changes and making those changes. So saying things like, I appreciate you're willing to share that. You've tried really hard. And I see that and value that. Reflecting. So reflective listening statements can be as simple as, you just said, something, and verbatim, I'm going to say it back to you. That can give clients an opportunity to correct you if you didn't hear them right, or to or to say, to kind of confirm, yeah, you heard that right, that makes sense. And then summary here, it's technically a type of a reflection, but really you're kind of taking all that you know, right, from a conversation, and if it's a client or family you've been working with for a while, kind of summarizing what you've heard, making sure that you're not missing anything. And so reflections and summary statements, which are a type of reflection, can really help clients feel heard. And also for you, make sure that you didn't miss any important information, and that you're really accurate, right, in your understanding of what might be happening. Okay, I'm gonna watch this very brief video on the OARS skills.
Let's start by learning an acronym that we use to describe these very concrete, engaging skills. OARS. So what does the acronym OARS represent? OARS stands for open-ended questions, affirmations, reflections, and summaries. These are the basic engaging skills in motivational interviewing. O stands for open-ended questions, and we contrast open-ended questions with closed questions. Closed questions, the answer is yes or no. Open questions have the value of helping clients to explore their own thoughts, experiences, and feelings in greater detail. A stands for affirmation. An affirmation is really nothing more than you noticing something positive about your client and bringing that forward in an explicit fashion. R stands for reflection. Here we're talking about reflective listening or active listening. You're offering a guess about what the client has had to say to you, but you're offering that guess as a statement and not a question. S stands for summary. And summary is really nothing more than you taking an opportunity in the course of your conversation with your client to let them know that you've been following, you've been listening, you've been tracking by offering them a brief summary of what they've had to say to you so far.
So succinct. Love that video. That's all I have. I'm gonna, in the slide deck, there are some more slides going into more detail on the OARS skills that you can take a look at afterwards. But due to time, I'm gonna wrap it up there and just would like to acknowledge Dr. Brittany Bryant. I even put it as a plural because she was so helpful for sharing the content here, CalMap team, and then all the clients who give me the opportunity to kind of get this experience and to learn from them, mentors and supervisors. So with that, let's see if y'all have any questions.
Thank you, Evan. So we do have, our optional Q&A at the top of the hour from 1 to 1:15, but wanted to see if anyone has brief questions before we go into the case-based learning, and would welcome everyone who's able to turn your camera on so that we can engage together. Evan, a question came up in the chat from Amina about how can you monitor change without being annoying our peers if you're judging, which I think is a nice question and also relates to a question that came up last month in our DBT didactic.
Yeah, that's a great question. I think the important thing, and this goes back to identifying clients' values and what they're bringing to the table, right? Is if you're really hearing them and reflecting back. So like with Tim's caregiver as the example, we might see that as like, this is a real problem, right? And maybe there's some anxiety or there's some avoidance going on, right? So recognizing what we call that like the writing reflex, this reflex to like, oh, let me fix that for you, oh, you're making your pasta, you're going to overcook that. It should be al dente actually, right? But if the person thinks that they're cooking the pasta fine, or maybe Tim's caregiver doesn't see him going to school as the biggest problem in their life, right? Maybe they're experiencing housing instability, for example. Reflecting back to them what you're hearing that they're experiencing in their life, like Tim's caregiver, if you're, coming with a lack of judgment, expressing empathy, Tim's caregiver will let you know, actually, there's this other thing going on, right? Or they might say, yeah, Tim not going to school is like the most stressful thing in my life. And so you can even say that it sounds like that's really stressful for you. And they might say, yeah. And so if you're kind of checking, that could be a way to kind of check in what they have and what you're hearing them bring to you. And that can make people feel really, really understood. that also can help you figure out, is this something then that I can check up on, right? And use their language, hey, last month or the last time I saw you a few months ago, you said like Tim not going to school was like a huge stressor in your life. How's that going? That can show that you heard them and you're checking in because they identified it. So that I hope that kind of answers the question, is just paying attention to their values and priorities.
Thank you. So the question was a little bit more about, like, once they identified, they're going to make a change. Let's say they're going to make a checklist for what they were going to do before going to school or something. And they made this commitment here in the clinic, but now we're going to have a check-in or monitoring the fact where, you have a goal now, and how are you going to monitor it? It's primarily you just sending a message to my chart, or calling them up and saying, hey, did you do this? Or you have a follow-up schedule. And that, I feel like, rolls the ball completely in the patient's realm. I mean, it is always with them, but if I start calling them up and checking up on them, sometimes they feel just annoyed that why am I bugging them over this? So
I would not try to use these principles like through not face-to-face. These are designed to be face-to-face. So I wouldn't kind of think about applying this through my chart messages. But let's say you identified a goal, there's a checklist, right? And the next time you see them or you call to check in, you could ask, how are things going, right? And it might be okay if they identified that they wanted a goal, they wanted a checklist, they wanted to try some of these things, then you have permission because it's something that they have identified as a priority. Now, you might inquire, you might want to know why they haven't made progress or what has worked, right? And so you could just ask, like, what's been working, what's been helpful here? I gave examples about like reflecting back verbally what people are saying, but you can also reflect their behavior, right? And so it seems like, for example, I might say something like, it seems like they're, having this checklist was something that felt really important last month. And maybe right now there's a lot going on. It's been hard to kind of follow. You could say something just like that, not asking a question, just kind of a statement or a hypothesis. That'll give them an opportunity to respond and tell you if that sounds right. Or actually, no, this isn't really a priority. There's something else going on right now, right? Or I need to reevaluate, this checklist, or if there's another solution.
thank you.
Helpful?
Very helpful.